Welcome to tonight's webinar, Cancer Prevention and Lifestyle Medicine, What's in Your Control. This program is being sponsored by the Johns Hopkins Kimmel Cancer Center in the National Capital Region. My name is Pam Getz, and I'm a program manager at the Sibley Memorial Hospital. We are recording tonight's program, and the recording will be mailed out to everyone who has registered within the next 3 days. Dr. Engle will be giving a talk, and then we'll take some questions at the end. If you would like to submit a question, please do so in the Q&A box at the bottom of your screen. Dr. Engle will answer as many of those questions as possible, given time allowance. Note that closed captioning has been enabled for this webinar, so if you would like to see captions, go ahead and click Show Captions at the bottom of your screen. Now, it's my distinct pleasure to introduce you to our speaker, Dr. Jessica Engle. Dr. Engle is a rehabilitation physician specializing in cancer rehabilitation with clinic locations in the Baltimore metropolitan area and Washington, D.C. Dr. Engle uses a multidisciplinary approach to treat the whole person throughout the cancer care continuum. Her focus is on addressing cancer and impairments related to cancer treatment. She aims to improve quality of life and maintain and improve function whenever possible. Dr. Engle is also certified as a lifestyle medicine physician with the American Board of Lifestyle Medicine and the International Board of Lifestyle Medicine. Dr. Engle, thank you for being here. The floor is all yours.
Hi, thank you so much for having me. And I had a little glitch right before we started where my computer froze, so hopefully everything is here. If not, I'll kind of fill in the gaps. But I'm here tonight to speak about lifestyle medicine and cancer prevention, risk reduction, and how can lifestyle medicine help, and what are some ways that you can be empowered. There's my glamour shot. And like Pam said, thank you very much for having me, everyone. And thanks for taking time away out of your busy schedules tonight. I do physical medicine and rehab, and I'm a part of the rehab department as well as the oncology department. And I do cancer rehab, help with the assistant program director of the PM&R residency, interim director of the post-COVID clinic. And then I also was very, very lucky, and thank you so much to them, to the American College of Lifestyle Medicine, for the Stephen Turner residency and faculty scholarship. And so I just wanted to take a moment out of your busy schedule, if we could all just close our eyes and kind of get into what we're learning about tonight and put everything else aside and kind of have this moment. So if you can just close your eyes and take a moment and just take a deep breath in through your nose and out through your mouth, and in and out. Feel your chest rise and fall with each breath. Feel your feet on the ground and the position of your body. Do things feel cold or warm? Maybe there's a breeze. Maybe there's some noise in the background. You're going to focus on the right here and the right now. And take a moment to just kind of analyze how you're feeling. Are you awake? Are you tired? Do you have maybe a joint that aches? Maybe you're feeling like you had a good workout and something is feeling particularly well stretched right now. Maybe you feel like you need to stretch. Just focus on your breath as well, going in through your nose and out through your mouth, and just kind of taking a moment and having some time for you and focusing on you. And realizing where you are and what we're going to focus on tonight, and focus it on yourself and how you can help yourself and be present here and now, and let the other cares of the day or the week or the year drift away, just to be present here and now and focus on this time. And just a couple more deep breaths through your nose, in through your nose and out through your mouth. And again, and out And then when you're ready, one more time, in through your nose and out through your mouth. And then when you're ready, you can slowly open your eyes and come back to the current place and time and get ready for our virtual lecture. Okay. So thank you very much, everyone, for doing that and taking some time for you. I have no disclosures, and I did want to start with this quote from Paul Conthidi from When Breath Becomes Air. Being with patients in these moments certainly has its emotional cost, but it also has its rewards. I don't think I ever spent a minute of any day wondering why I did this work or whether it was worth it, the call to protect life, and not merely life, but another's identity. It is perhaps not too much to say another's soul was obvious in its sacredness. And that's something I try to bring to the table every day when I work. And I'm a physical medicine and rehab doc. And what does that mean? So physical medicine or rehab or PM&R or rehab or physiatry, we have so many different names, but we work on enhancing and restoring function, ability, and quality of life to those with physical impairments or disabilities affecting the brain, spinal cord, nerves, bones, joints, ligaments, muscles, and tendons. And we're known as physiatrists or rehab docs. We're unlike a lot of other fields in that we don't necessarily focus on a medical cure, but we try to maximize independence, especially in activities of daily living, such as getting dressed, bathing, using the toilet, and improving quality of life. We're experts in designing a comprehensive patient-centered treatment plan and are integral members of the care team and utilize cutting edge as well as time-tested treatments to maximize function and quality of life for patients. And then I specialize further in cancer rehab. And I did a fellowship years ago in cancer rehab, and I work on identifying, diagnosing, and treating cancer-related impairments using a rehab approach. And I treat the whole person and try to employ a variety of methods, including lifestyle modifications, number one. And this is something I've been trying to do even before I did the lifestyle medicine course. Osteopathic treatments, techniques, medications, injections, referrals, etc. And I think we have to realize here that we're going to try to talk about various ways to prevent chronic disease or help lessen chronic disease, prevent additional cancers. But at the same time, you could do everything right that we know of, eat right, get the right amount of water and exercise and et cetera. But we sometimes, and that can help prevent, but it can't 100% prevent. It can't 100% change. So we cannot change the cards we are dealt, just how we play the hand. And then just a little history of cancer rehab and how it started and helping folks. And cancer rehab is a medical care that should be thought about throughout the cancer continuum. And we work on physical, psychological, cognitive impairments to maintain or restore function, reduce symptom burden, maximize independence, and improve quality of life. We take an interdisciplinary approach, working with the whole team, and family are the center. And we have to remember that for a lot of folks, when they ring the bell after being done with radiation or treatment or that actually is not the end of things. And the effects of cancer do not end, and side effects can linger or pop up. And so that's where it can be very anxiety provoking. And that's where I try to help. And that's one of the jobs I do. And so I just wanted to mention that as well. And so that also that the median is not the message. Stephen Jay Gould was a anthropologist who was diagnosed with a rare cancer and told, basically get your affairs in order. And he said, well, that's the average, but not everyone's the average. There are these other parts of the equation where sometimes people live longer. And what happens to those folks and how do you deal with that? And so he ended up writing a really great paper that was in JAMA. He ended up living decades longer and unfortunately passing from a completely different unrelated cancer. But we have to remember that, there are people that do live on. There are people that will live on and get other illnesses. And chronic illness is a big issue, and which brings us to lifestyle medicine, what we're all here for tonight. So the definition of lifestyle medicine is a medical specialty that uses therapeutic lifestyle intervention as a primary modality to treat chronic conditions, including but not limited to cardiovascular disease, type 2 diabetes, as well as obesity, and also try to prevent other issues. And we use evidence-based, whole person prescriptive lifestyle changes to treat and can sometimes reverse some conditions. Sometimes reverse some conditions. For example, obesity could be potentially reversed with intensive lifestyle interventions. And there's 6 pillars of lifestyle medicine. One is a predominantly whole food, plant based diet. Another one is physical activity. Then there's restorative sleep, not just quantity, but quality of sleep. Stress management, avoidance of risky substances, and then positive and meaningful social connections. And this also provides effective prevention for these conditions. You'll see that the World Cancer Research Fund has mentioned how this there are cancer prevention recommendations, for example. And so being at a healthy weight can help prevent cancer. And that is a component of lifestyle medicine. Physical activity also, a diet with whole grains, vegetables, fruit, and beans, again, a component of lifestyle medicine. Limiting processed or eliminating processed foods, foods high in fat, starches, sugars. Limiting or eliminating red and processed meat, because unfortunately some of those are known carcinogens. Limiting or eliminating sugary sweet drinks. Limiting or eliminating even alcohol consumption, because unfortunately alcohol can cause cancer. We want also your macro, micronutrients, vitamins and minerals and everything to come from the foods you eat, not necessarily a pill that is taken. They also recommend breastfeeding if at all possible, and follow recommendations after having a diagnosis of cancer. And that's just one example. And so they do not want people to take supplements unless you're deficient in that nutrient. They want you to try to get a rainbow colors of food and try to get various different foods to get all the nutrients that you can out of those foods, which I'll talk more about. Specifically, a lot of vegetables and fruits, which have within them obviously calories, but also various components that are antioxidants, vitamins and minerals. Even protein is found in vegetables. And so they want you to have all these antioxidants from this rainbow of different foods. And so when I see patients, I want to look at their the whole picture of them. And what does your life look like? What does a typical day look like for you? Are you having trouble sleeping? I really focus a lot on sleep because I feel like it's a foundation for a lot of things. And what, are you engaged in any physical activity? What is your occupation? What hobbies do you enjoy? Are you having any trouble eating or drinking? And this is a lot to do all at once, so we kind of have to do a little bit broken up, a little bit piecemeal at times. And, if there is any pain, and I try to look at the whole picture and see if there are any lifestyle interventions that might help in some of the issues that they have. And some ways to maybe tweak taking medication at a different time at night instead of the morning, or maybe sleep is a big issue and talking about that, which we'll get to. But I want to know what's important to them. What is their purpose? What is their reason for being? And what is their goal? And how do you get there? Or how do you get to that purpose? And what do you want your life to look like in, I don't know, a year, 5 years, 10 years, 15 years and beyond? And none of us know how long we have, but to try to make the most of the time we have. And if we want to, let's say, be around to see our, maybe I'll just come up with an example, grandchildren, great grandchildren, what evidence-based information can we use to possibly get to that time in the decades to come? If it may be that long. Maybe we're hoping that we have good mobility at that time and can do activities with our loved ones. And so what would it take to get there? And maybe are there tweaks that we can make now and lifestyle changes to accomplish that? And I think that's the bullseye, or that's really at the heart of what's going on with a lot of people. And so in lifestyle medicine, we use a collaborative technique where it is a coaching system where you're a partner with your patient to promote healthy changes. Patients know most about themselves. You're your expert, and we're just going to try to help guide you um, to help meet your goals and see if you're ready to work on a specific goal or ready to make a specific change. And one technique that's used is something called SMART goals, and that's an acronym, SMART, for specific, measurable, achievable, relevant, and time bound. So um, do you have a goal or goals that you want to achieve? And then can you have accountability for it? For example, maybe you want to have a specific goal of walking. I'm just going to pick something random, 10,000 steps by, right now you're walking 7,000. You want to hit 10,000 by, I don't know, September 1st. And you're going to use a smartwatch, which is, you don't have to use that. You can use an old fashioned pedometer or something like that. And you're going to check in maybe on July 1st and August 1st with your calendar to see if you're getting close to meeting those goals, and you want to try to maybe hit them that 90% of the time, or I don't know, 6 days out of 7 each week. But you want a measurable goal that is achievable. Non-achievable goals would be trying to maybe you walk, whatever, 100,000 steps a day, something like that, that just is not something that we're going to hit. And so, you want to pick something that is sustainable and that is achievable, and see also, are you motivated to make that goal? Are you planning that goal? Are you in this, are there any things that need to be tweaked? And that's something that we can work with lifestyle medicine. And it's great to have accountability. And some people use social media for that. Sometimes people have a friend that they maybe walk with, a wearable device, a smartphone, things like that, for example. So the accountability is really important as well. And not, Rome wasn't built in a day, and not everyone is perfect. So there's going to be good days and bad days. And lifestyle medicine is really precision medicine, and I'm sorry, it is something that is very important, because it's thought that 80% of chronic conditions are attributed to lifestyle causes. And so there's a thought that in the United States, for example, 40% of all cancers and 45% of cancer deaths are related to modifiable risk factors like smoking, excess body weight, and alcohol consumption, physical inactivity, and or poor nutrition. And we don't 100% know how to prevent cancer, but we do know that healthy choices like avoiding risky substances such as tobacco and staying active can help reduce the risk of cancer. And these are important, at any stage of the journey. There can be lifestyle changes that can make a big difference in someone's quality of life. So again, that's avoiding risky substances or minimizing substances that are risky. Even harm reduction might be also a piece of this. Stress management, because there's a lot of unhealthy stress. There's a lot of, where maybe you're driving and someone cuts you off and you're like, oh my gosh, why did they do that? And that originally your reactions to stress were there for if a bear was running after you or something like that, or for a fight or flight mechanism. But this is if the copier's jammed or something like that, it's a lot different than a bear or wildebeest coming after you. Social connections that are positive, physical activity, nutrition, and restorative sleep. And so the first piece of the puzzle is the mostly plant-based nutrition, whole foods. You want things that are not processed or as minimally processed as possible. And so that's something that's really important. And so the the um the examples might be, things that are, or, bananas, apples, lettuce, and things like that. And you want things that are rich in fiber, antioxidants, and nutrient dense. Um, it's really important to have a lot of vegetables and a variety of vegetables. It can help prevent chronic disease, chronic conditions, and possibly even reverse chronic illnesses such as obesity. Not everything, unfortunately, can reverse, but sometimes it possibly can. And the more plants you get, the more antioxidants you can have, and so these are nutrient dense. And so you want minimally processed veggies, fruits, whole grains, beans, nuts, and seeds. And okay. So sometimes when we talk about referring to nutrition, we might do so to help folks that have muscle wasting, have lost or gained weight, or are interested in losing or gaining weight, have food aversions, decreased appetite, need strategies for increasing a particular micro or macronutrient. We have to remember that there's certain things that are really good for us, like high in omega-3s. They're flax seeds, for example, or walnuts are high, and they can help prevent, flax seeds can help prevent constipation, also be anti-inflammatory, for example. And that can be very helpful. And omega-3s are anti-inflammatory. Those are things that are found, for example, in nuts. And so you want half the plate ideally not to look like that. That was supposed to be like I don't know, like a grazing plate for people that are um eating at a party or something, but half the plate should be fruits and vegetables. So half your plate from the start, fill it up, fruits and vegetables. There's even theories that if you have non like things like lettuces and cucumbers, and there's even been research, evidence-based, I should say, not theories, but like lettuces and cucumbers and non-starchy vegetables first, that helps fill you up. And having a full glass of water first, because you want to make sure you get enough water throughout the day as well, especially if you're exercising. Some people have ostomies and they have more water loss, and it's getting warmer outside too. And so you want at least, if as long as you can have, you don't have a very restricted diet, at least half the plate vegetables and fruits and a variety, a quarter whole grains, such as something like whole brown rice, quinoa. When a product has to say enriched, that means usually it's broken down into little pieces and then they put extra vitamins in it or something like that. So that's not actually the whole grain. That's not the way Mother Nature intended it. And then a quarter protein, which could be like beans or nuts or something like that. Avoid processed foods. We see processed foods everywhere. We see a ton of commercials. We see it, when we're driving. We have ads on social media. We have, ads on television, and they're in our face all the time. But ideally, you want to try to avoid those things and prepare ahead of time to maybe have, if you're not allergic or have no issues, some nuts with you, or some additional, maybe a banana comes in its own packaging. If you don't have an issue with potassium or allergies or something like that, and to have it with you so you're prepared when you have those kinds of things come your way. And we don't want to have supplements if at all possible. For example, if you are low in B12, you want to try to be able to eat it. However, sometimes people do need a B12 shot, if only if they're low in B12, only if they're low on a lab. Would they need that, or if they've had specific GI surgeries. But you really don't want it for a supplement. You really want to try to eat it, and that goes for all macronutrients, vitamins, minerals. You want to try to have at least 5 to 6 servings of fruits and vegetables a day total, not 6 fruits, 6 veggies, but at least I mean, you could, but try to have at least 5 to 6 servings a day of the vegetables and fruits. Maybe you'll have 4 different vegetables and 2 different fruits, and focus on adding the good stuff, not what you're taking away. Maybe you're adding an extra serving of broccoli. Maybe you're adding a salad to your meal first, instead of it being something that's like deprivation. And next is physical activity. Physical activity is so insanely important because you have to think about how we're really not supposed to sit all day. Sitting is not great. We're always, on our phones and sitting and everything. But ideally, we want to be moving, and it's important. Anything counts. Parking further away at the store and walking further if you're able, taking the stairs instead of the elevator. And you can't pour from an empty cup. So you have to do these things for you. And it's hard in society. A lot of times we want to give and give and give. And we have to do things for ourselves. And maybe saying, okay, I'm going to watch this TV program, but I'm going to, walk around the house during commercials, or I'm going to walk on my stair stepper during the show or the movie or whatever it may be. But it's very, very important to get physical activity, and it can prevent cancer. And regular and consistent physical activity combats the negative effects of sitting or sedentary behavior. Adults engaged in both physical activity as well as purposeful exercise as part of overall health and resiliency, and it can prevent so many things. I have just a cliff notes on it right now, kind of a thing, or I don't know, I'm supposed to say I have a brief abbreviation of what you should do right now, but there'll be more to come. So the American College of Sports Medicine is one of our big governing bodies in the United States of how much activity we should do. In 2010, they said folks with cancer should get at least 150 minutes of aerobic activity each week, and daily stretching. And the funny thing is the guidelines for cancer are the exact same guidelines for people that don't have cancer. So everyone should get at least 150 minutes of exercise a week. And that was released in 2019. And that's a moderate intensity of aerobic activity. And what does that mean? That means at a moderate intensity, you can talk to someone or to, I guess, yourself, but you can't sing. You don't have enough wind power. You don't have enough uh, reserve to be able to sing. If you're able to sing, you're not at moderate intensity. If you're having trouble talking, you're vigorous, and you actually could do even less activity each week, but at least 150 minutes. And that should be broken up into 30-minute clusters. And then, you want to try to get at least 150 minutes of exercise a week at moderate intensity. We have to remember that those are the same recommendations for someone with cancer or without. To also do strength training is really helpful, because it helps with endurance as well. And we have to remember that the elephant in the room is that cardiovascular disease in the United States is the #1 killer. And by doing exercise, you're helping prevent that. Exercise helps with so much. It helps with free radicals, and it helps with being more mobile, preventing blood clots, being able to keep social interactions, preventing cancers from occurring, and certain cancers from reoccurring, and prevents other cancers. It's crazy how helpful it is. So this is from a paper called Exercise is Medicine. So actually, cancer helps prevent the occurrence of 7 types of cancer that we know of. It might even be more, and the research just hasn't been done in that area, but it prevents breast cancer, endometrial cancer, kidney cancer, bladder cancer, esophageal cancer, stomach cancer, and colon cancer. At least prevents those 7 types of cancers. Now, it's not 100% prevention, but it does have some protective effect. And that's great. And it can help actually improve survival after a diagnosis of breast, colon, and prostate cancer, and maybe even more. And exercising during and after cancer treatment decreases fatigue, anxiety, and depression, improves physical function and quality of life, and does not exacerbate lymphedema. Okay. So those are all really, really important. And so exercise is a modifiable risk factor. And again, it can help prevent colon, breast, bladder, kidney, stomach, esophageal, and endometrial cancers. And decreasing sedentary activity lowers the risk of colon, endometrial, and lung cancers. And improve survival from exercising before and after a cancer diagnosis. Let's also focus on stress. Stress can be good if we have to run away from a bad situation like a fire, heaven forbid. But it can cause a lot of anxiety, decrease, it can cause depression, obesity, immune dysfunction. And you have to recognize when there's negative stress responses and identify coping mechanisms and reduction techniques to improve well-being. One example is something called four-square or box breathing. And it's when you imagine there's an invisible box. And so you try to inhale for 4 seconds. And there's different versions of all these different breathing things. Inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and inhale again. I'm sorry, and hold for 4 seconds. So I don't know if I can show you, but it would look like something like this. It looks like a box, kind of. I don't know if you could see my picture, but I have no idea actually if you could see my picture or not. But you would inhale for 4 seconds, hold for 4 seconds. Now exhale for seconds, hold again for 4 seconds, and then you go back and repeat it. And this is something you can use if you have any issues in you're stressed, you're like, oh my gosh, I lost my package or whatever it may be, my computer crashed or whatever it may be. You can use these different techniques and to try to normalize and decrease in that moment. Another great thing is Reiki, Tai Chi and Qigong are also very helpful. And they can actually, Tai Chi can be very, very helpful as well, and Qigong with some balance and as well as helping build muscle mass and bone mass, and it can be exercise and mindfulness. So it checks a lot of boxes. And you want to try to practice something daily, and people need different amounts each day. People sometimes use meditation to avoid a fight or flight or response of the sympathetic nervous system, and exercise can help as well. And then risky substances. So you want to avoid tobacco and excessive alcohol consumption because they can be, linked to chronic disease and death. And there's different techniques that can be used, and lifestyle medicine can be helpful. Sometimes counseling can be helpful, cognitive behavioral therapy, and trying to break various patterns. And this is very tricky and complex. If you don't drink alcohol, don't, now is not the time to start. Oops, and I apologize for going to the next slide. But there's different thoughts on alcohol consumption. Alcohol is attributed to some cancers, and maybe more. The United States actually probably has a more liberal view on alcohol consumption than some other countries. In Europe and other countries, sometimes and some other places have reported that you should not drink any alcohol. There's been some articles against drinking any alcohol. For example, I think there was one last year in the Journal of the American Medical Association. But even there's only a very little amount that's is considered possibly okay. And it's a kind of a controversial subject, but there is definitely evidence against alcohol, and of course evidence against tobacco, and has been for decades. Okay, so restorative sleep. That doesn't just mean, hey, I'm in bed for 12 hours. Actually, that's too long. Over 10 hours can actually be bad. So because that can mean that someone's waking up frequently, or they have sleep apnea and they hunger. And this is for adults, because kids can, sometimes, obviously, like babies need more sleep. And not sleeping enough can cause your brain to react a little too quickly, and it can cause, aggression and things like that, as well as sluggishness, low attention span, decreased sociability, depressed mood, decreased deep sleep, decreased caloric burn during the day, increased hunger, decreased feeling of fullness, insulin resistance, and decreased performance. And you want to have at least 7 hours a night for optimum health. You want to try to create a good environment around sleep, limit blue lights. The bed is only to be used for sex and sleep. During COVID, a lot of us use the bed for folding laundry, watching movies, playing, I don't know, Guess Who or whatever, because we're so isolated and had to do everything in the confines of our home. But you really should only you have to habituate yourself to using the bed only for sleep and for sex. You're supposed to limit naps and try not to have naps or exercise too close to bedtime. Bright white light therapy at 30 to 90 minutes of 10,000 lux in the early morning, which is basically like a box that you put your face in and it's all bright to try to wake you up, mimic how it's supposed to be bright and light during the daytime, can be helpful in preventing fatigue. Also, massage therapy, yoga, acupuncture can help. Sleep hygiene is super important. Having a sleep routine is important, and making the bedroom sacred for sleep and sex and not for other activities if at all possible. And exercise can help limit fatigue and help you get better sleep as well. Social connections, positive social connections and relationships affect our physical, mental, and emotional health. Leveraging the power of relationships and social networks can help reinforce healthy behaviors. During COVID, a lot of us, again, were very isolated. The Surgeon General has also focused on trying to limit and decrease loneliness because it greatly affects our health. We are supposed to be most of us are supposed to be very social people, and so having these positive connections, having someone that has that you can confide in, and having some confidants is really 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 helpful, and can help decrease stress level, can make you want to get out and see them and move more, and so many different things, and help your physical, mental, and emotional and social health. So this is an example of some of the programs that we have for patients and families that are affected by cancer, be it active treatment or otherwise, that Pam and Kara have spent, and others have spent so much time putting together. So I just wanted to give an example here because I do work in cancer rehab and we're very familiar with these programs. There are these programs for patients that are currently in treatment or cancer survivors, and it doesn't have to be that they were in treatment at Hopkins. It could be another facility, and through the Center of Patient and Family Services. And for example, there's Reiki multiple times a week. There's yoga. There's meditation. I think these are the June dates. But these are some examples. There's programs for folks with that have had breast cancer, bladder cancer, talking and walking, cancer caregivers, brain tumor, pancreatic cancer, and you can just see the list here. It's quite amazing and it really is something to aspire to have all these programs and to constantly be expanding for more. There's art therapy, music therapy, nature therapy, and I might be missing even some young adult programs, children's programs, and various types of cancer. So I just wanted to kind of share these real quick and working on, path to purpose. The yoga is for folks of all abilities, and there's survivorship programs as well. And there's, for example, a yoga mat program as well as a yoga chair program, meditation, and others. And there's other programs that we help folks get involved with that promote the social aspect, promote the exercise aspect, promote there's even topics on nutrition during the survivorship programs, trying to hit all those pillars. Local agencies that we work with, some things are virtual, sometimes people prefer in person, and we can help them go to those avenues as well. And there's other programs like Silver Sneakers and YMCA programs and things like that that we work with in local agencies. There's, for example, a Sibley Senior Association that has programs that include but are not limited to mindfulness, outdoor walking. And just to look at someone who's a cancer survivor, there's a lot of unmet needs that we try to hit on in cancer rehab. And that would include the physical, psychological, activities of daily living restrictions, such as having trouble dressing or financial issues, as well as relationship issues. And we try to get there as soon as possible through this process called prehab. I'm going to kind of go through this quickly because I don't know if this applies to everyone, but trying to get there as soon as possible to identify impairments as soon as possible and look at the whole person to try to optimize as much as possible before someone maybe has surgery, or something like that. I'm also part of the PRIME program, or pre-surgical program, at looking at integrated medicine for elders, and it's looking at these specific um, patients that through an interdisciplinary lens, looking at nutrition, physical therapy, physical medicine or rehab, geriatrics, pharmacy, surgery, anesthesia, palliative care was part of the team, and I think they're coming back again. And we discuss the patient preoperatively, meet quite frequently to discuss how they're doing, and we try to use this enhanced recovery after surgery society plan. And this is for patients, I think, that are over 75 is the cutoff for this particular grant. And I'll see some patients try to optimize them and have lifestyle interventions and use a physical medicine and rehab approach again. But this will not delay their care, and that's something that's very important. And I thought maybe we could take a breather, quite literally, and work on just taking a quick breath in through your nose and out through your mouth, and really focus on this like belly breathing, and it helps work the lymphatic system. And that's an example of a live person, well, a picture of a person doing it. And we know that patients with cancer are numbered in the United States at over 18 million, and over 50% are over 65 years old. And we use the definition survivor as any time a person's been diagnosed throughout the rest of their life. And we know that there is a big chance of additional comorbidities, other cancers, chronic impairments, long-term impairments, and compromised quality of life. And we know that there's a lot of benefits from rehab. Again, and this feeds right lifestyle medicine, helping with mobility, function, energy, nutrition, social, mood, cognition, and sometimes people have, better appetites as well. We know that gaining weight is not something that is looked favorably upon during treatment for breast cancer, and physical activity can reduce this risk. And gaining weight, unfortunately, can have a increased risk of mortality. And we know that weight loss can also help endometrial cancer patients, and doesn't apply to every cancer. This was a study where they showed that patients that were involved in high intensity exercise one-on-one with a coach actually did better during their treatment and had less dose reductions than folks that didn't have any exercise or had a home-based exercise program. These are the recommendations again, because I think they're so important. I had to have them in here twice. And we know that sitting is associated with a 30% higher risk of colon cancer. So I should probably be standing during this lecture. Exercising before diagnosis is great. However, exercising after diagnosis has even the greater influence on the outcome in cancer. So it's even more important to exercise after diagnosis of colon cancer and probably others. And being physically active is one of the most important steps for people of all ages and abilities for cancer prevention, treatment, and control. Every survivor should avoid inactivity. Exercise can improve fatigue, physical function, health-related quality of life, anxiety, and depression. And again, it's very, very important. We know that exercise can prevent cancer by helping maintain a healthy body weight, regulating hormones, telling cells to die when they're supposed to die, including malignant cells, controlling how the blood cells are formed, and decreasing these inflammatory pathways, helping cells replicate the way they're supposed to, and improving reactive oxygen species and trying to limit those and decrease inflammation. There was another study that showed that active women with breast cancer achieve similar results to active women without breast cancer, and better results than sedentary women when these women were exercising that had breast cancer. And I was just going to take another break to just do a little side bend since we're getting to the very end of things, to work what's called the latissimus muscles, which are this big muscle in your back. And this is how to do it. Also, to let you know, lymphedema is not worsened by exercising. You start low and you go slow. There is actually a lower risk of lymphedema if healthy weight is maintained through exercise and diet. You want to avoid inactivity. If someone that is at risk for lymphedema or has lymphedema is exercising, you monitor areas for changes. You also want to avoid severe heat or cold, or extreme heat or cold, and probably anything that wraps tight, like aerial yoga. There was also a study that came out in 2016 by Ferguson that showed that having blood draws, injections, or going on flights does not affect the affected side, and cause an increase in lymphedema. However, if you have another limb, you might want to try that. However, axillary lymph node dissection, infections, and radiation could increase the risk of lymphedema, as does a large increased body mass index can increase the risk of lymphedema. Those who exercise after a cancer diagnosis have fewer side effects, better stamina and mood, and decreased risk of recurrence. The American Cancer Society says there's a lower risk of blood clots, better quality of life. You can keep your social contacts. And then I wanted to just say real quick, and I'll probably close it with this, that mindfulness is super important. Viktor Frankl really harped on this, and he said those who have a why can face any how. He unfortunately was in a concentration camp, and unbeknownst to him at the time had lost his entire family and many people that he knew. And he told himself, though, that he was going to get through this because he wanted to see his loved ones again, and he was going to do whatever it took. And that was his why I want to see my loved ones again. And he noticed that since this was his goal every day, I want to see them again, I want to see them again, I'll do whatever it takes. And some people didn't have a goal like that. Even though they were getting more food, they were getting sicker and unfortunately dying, and he was giving away his food to those folks, and yet he was continuing to do okay. So he said those who have a why can face any how. So it's important to have a goal, a person that you want to see, a thing that you want to do, and that will be your why. A grandchild, for example, and you can face any how if you have a why. And again, those are the 6 big pillars of lifestyle medicine: to avoid risky substances, stress management, social connection, physical activity, nutrition, and restorative sleep. And that's what it helps. And then I had a shoulder shrug and some other information. And okay, sorry, I went fast at the end. Okay, so different questions. Cancer preventative supplements, I don't know of any at this time. Try to get as much as possible through food is really what it is. And not that we're trying to overeat, but that is something that it's something that we're trying to, have eat the rainbow and have a lot of different vegetables that have these phytonutrients in them. Do you do any testing to evaluate where a person is before working on solutions? Oh, goodness, yes. It depends on the circumstance. But I do, yes, I frequently ordered labs or x-rays or imaging as needed. Yeah, and it depends on the person. I think we talked about how much alcohol is okay for a male cancer survivor in his 70s, and it's going to depend on the oncologist too. If you're being a purist, possibly 0. But it depends. There's different schools of thought, and that's controversial. It might be, 1 glass, maybe 2 glasses, but definitely not more than that. And so we'll kind of leave that up to the oncologist and primary care. Okay, so for sleep, that's something that has to kind of be fleshed out. It's a little bit tricky. And it there's other components that can go into it. So I might have to defer to it. It's very specific. But a lot of there's a couple of things. I think that a lot of people have wearable devices that are not a perfect science about sleep. Um, and um, and so I think it kind of depends on the person. And there's some people that say they feel like they're getting great sleep, and then they put on a wearable device and it says, they're in the green this much and the orange and the red, and they're not getting the sleep they thought they were getting. I don't know if we know 100% what to make of that just yet. So unfortunately, I probably need hours to answer that. So autoimmune issues tend to have a lot of inflammation, and vegetables tend to be very anti-inflammatory. That was another question here. And we have, do people with cancer or other major medical issues need to be treated at Sibley or Hopkins? Oh, I think Pam's taking that to take advantage of these classes programs. And let Pam answer that. Okay. Oh boy. Okay. So there's probably a lot to this one too. Just read in the news that the UK developed an individualized vaccine to heal any cancer at any stage. What do you think about it? I have not read that. I would hope that would be amazing if that was the case. I don't think that is 100% the case right now, because it would mean tremendous things for a lot of folks. There are vaccine trials that are going on in various stages that or there are more information about that you could talk about with various oncologists or look at clinicaltrials.gov, but I don't know that that's the case, that there's a something that will completely heal cancer just yet. I don't think it's the case. And I think I know Pam has things to say, and I don't know if I even got to all the questions. So, um,
Dr. Engel, can I just ask,
yeah.
are you willing to allow us to send out the slides? Someone is asking about
Oh,
that.
yeah.
Okay,
Yes.
so we'll send those out too. Great.
Yeah. And then let's see. Um, is there a lymphedema prevention program for patients who are high risk for lymphedema? So there is folks can be at you're at higher risk for lymphedema if you've had lymphedema in another part of your body. And this is or had radiation to that area, multiple surgeries to that area, um, uh, infections or seromas or complications, hematomas, things like that. We know, and I mean, there's other things that can make you at risk as well. However, there are some folks that we don't think will get lymphedema and do, and some folks that we're pretty positive we're going to get lymphedema and they never do. And so the biggest risk reduction that can be done is to maintain a healthy body weight. We know that body mass index is a big risk factor for lymphedema. The Ferguson paper stated it, a lot of other papers have stated it. And so we know that maintaining a healthy body weight is the biggest thing to help reduce lymphedema. And that goes back to all the lifestyle pieces. And as far as nutrition, I have a lot of great colleagues that I work with, like Hillary Burlow and some others. I don't want to leave anyone out, but in the interest of time. So I would defer to them for nutrition because they're amazing at that. Um, and have you heard of using beetroots to make soups, drinks? I think there is unfortunately a beet there's a lot of information about beets right now. I don't know that it's really evidence based. I think it's a great food and has a lot to offer, but I don't think that it is a cure all. And I think we need variety is truly the answer. But I'm going to turn it over to Pam before I go way too long. And I apologize that I can't get to all the questions. Yes, and also I should say lymphedema therapists that we work with, be it at Sibley or another hospital or another organization, are great at working with patients that are at risk for lymphedema. And there's different bioimpedance techniques that could be used. I'll just say real quick. to monitor like muscle mass and adipose tissue or fat tissue and water, and try to manage people that are at risk. Also, and working with lymphedema therapists could be very helpful as well. I'm going to pass it back. I apologize I couldn't get to everything, but I'm gonna pass the baton to Pam.
Great. Thank you, Dr. Angle. That was record number of slides under 60 minutes. So much great information. And we will be sending out the slides along with the recording in the next few days. Also, when each of you logs out of the webinar tonight, an evaluation will pop up. We really ask you to kindly complete that to give us some feedback to see how we can improve future programs. But we appreciate all of you being here. Dr. Engel, thank you for committing this time to sharing such great information. And we will be sending out that email. So if anybody has any follow-up questions, we will be sending out the calendar. But if you're interested in learning more about our programs and how to access those, feel free to reach back out to us. And if you're looking for resources in the community, we can also help with that. And I want to finally just thank Kara Woodshank, my colleague, for handling all the behind the scenes tech stuff. We couldn't do this without her. So thank you all for being here, and go walk around the block, eat some broccoli, do something nice for yourself. Thank you for being here.
Thank you. Thanks, Pam. Thanks, Kara. Thanks everyone for joining.